Hello everyone, my name is Supatchaya Tongtheng. My project is promoting burnout awareness and headspace utilization to address burnout in healthcare provider. It is a quality improvement project at a non-profit health insurance company. My project chair is Dr. Mashan. Burnout involves emotional exhaustion, depersonalization, reduced personal accomplishment, and negative work attitude. Factors leading to burnout include high stress, long hours of work, inadequate support, and short staff. Healthcare providers often experience high level of stress, burnout, and compassion fatigue due to the nature of their work, which can negatively impact their well-being and patient care. Given the negative impact of burnout on the organization and patient care, it is important to address burnout issue. As nurses make up a majority portion of healthcare workers and increased numbers of nurse practitioners, it is essential to address burnout among nurses and nurse practitioners to sustain quality of patient care. Even before COVID-19 pandemic, the National Academy of Medicine identified a significant level of burnout among healthcare workers in the United States. This issue affects 35 to 54 of nurses and physicians, as well as 45 to 60% of medical students and residents. Massachusetts Nurse Association reported 19% of registered nurses plan to leave their nursing job within the next 2 years due to burnout and stress. Burnout among healthcare workers increased from 32% in 2018 to 46% in 2022. Also, job dissatisfaction also increased from 33% in 2018 to 44% in 2022, as many healthcare workers expressed their intention to seek new employment. Local problems. In a recent survey via Microsoft Teams, note that 80% of advanced practice clinicians report burnout in the past 3 months, and team manager also concerned about burnout issue and staff turnover. We agreed to lead project that aim to decrease the level of burnout among staff. Human Resource report that the organization has an employee wellness program that provides free subscription to an online mindfulness training, as mindfulness training have proved to be an effective intervention that help prevent burnout. But however, only 10% of company staff using this application, and also this application is not well known within my team. To understand burnout, researchers explore elements contributing to burnout and compassion fatigue, with emphasizing their adverse effects on patient care. And also, there's correlation between burnout and decreased perceptions of care quality. Fostering resilience through mindfulness practice is essential in preventing burnout. Many researchers find mindfulness-based intervention effective in enhancing healthcare provider well-being. Work environment can also affect quality of care. As positive practice environment help elevate perceptions of care quality, these highlight the crucial need for supportive work environment. Many researchers have highlighted the effectiveness of mindfulness-based intervention in preventing burnout among healthcare providers. Online mindfulness intervention via mobile application is convenient for users and also proven to be effective. However, there are a few barriers that prevent users from utilizing the application. Factors affecting application utilization, such as user motivation, effective marketing, non-conducive environments, and cost barriers. The literature review highlights diverse measurement tools for assessing burnout, compassion fatigue, and mindfulness level. Burnout measurements can be categorized into generic and specific instruments. The widely use of the Maslach Burnout Inventory for healthcare professionals is one of the specific instruments that can be used among healthcare providers. Perceived stress scale is another widely accepted and reliable tool to measure stress level and stress contribute to burnout. Professional quality of life is another well-known tool that's used to measure compassion fatigue. 5-facet mindfulness questionnaire is another reliable tool that's used for evaluation mindfulness across 5 aspects. These instruments offer a comprehensive understanding of factors that influencing burnout, compassion fatigue, and mindfulness, assisting individuals in self-awareness and improvement. The purpose of the project is to reduce level of burnout and stress among healthcare providers in an outpatient settings. The project aims to raise an awareness about mindfulness as intervention for burnout and stress, and promoting the utilization of headspace applications as an intervention to reduce burnout and stress among healthcare providers. This project is currently experimental one-group pre- and post-intervention design. Headspace is approved by the team manager as it is proven to be effective and convenient to use and free for all staff. This project uses Plan, Do, Study, Act model, which is a repetitive 4-stage model for continuous improvement. Plan phase includes identifying objectives and choosing intervention and measurement. Do phase include implementing educational sessions and collecting data on mindfulness, burnout, and stress, and the data will be analyzed in the study phase. And then they will make some changes in the act phase based on finding. In this project, pre-test and post-test design used to assess outcome before and after interventions. The setting for this quality improvement project will be at a nonprofit health insurance company in assessment and care planning team. The company is in Boston, Massachusetts. Company mission is enhance health and well-being of individuals with substantial needs, emphasizing care provider well-being. The project will last about 6 to 7 weeks, allowing time for engagement with the mobile application and complete the questionnaire. As all the staff working remotely, this project will not be met in person. This project uses convenient sampling as it is suitable for remote work setting. Team director and manager will email and estimate 60 healthcare providers within assessment and care planning team. The provider will include nurse and nurse practitioners. For confidentiality and privacy, participants will use a specific number ID, which is zip code and last 3 digits of cell phone number. Eligible criteria include being a full-time provider and have access to a smartphone. Staff with severe psychiatric or somatic disease or have recent traumatic events or taking mood-regulating drugs or plan to leave in 12 weeks will not be included in the study. Sample recruitment will begin after an official approval from the director. The team manager, who is also community chair, will send a group email with project invitations 1 week before team meeting. The group email will be sent again on the day of the team meeting. The invitation includes project details, benefits, duration, along with handout about burnout and factors associated with health worker burnout from U.S. Department of Health and Human Services. Communication between DNP student investigator and participants will be via work email or Microsoft Teams. This approach will provide easy access for participants without in-person meeting. Interventions. Burnout presentation will be reviewed by the team director, and the presentation will be about 10 to 15 minutes during team meeting. The first part will start with a video from Surgeon General Advisory addressing health worker burnout. It is a 2-minute video. Then we will discuss the key takeaway from the advisory. The rest of the PowerPoint will include information from the literature review, information about interventions that are available by the organization, such as Headspace and other programs via Employee Assistance Program. The project timeline also will be discussed. After the presentations, team managers or director will encourage participants to try using Headspace for 6 weeks, aiming 10 minutes of daily use. To address barriers in using the application, there will be a clear instructions on how to access and navigate the application for unfamiliar participants. Participants are recommended to start with sessions relating to burnout, such as the signs of burnout by burnout with Dr. Laurie Santos, how to beat workplace burnout with Eve, headspace conversation avoiding work burnout. Each session is about 5 to 10 minutes. Participants can also follow courses such as managing anxiety, letting go of stress, balance, finding focus, self-compassion, self-esteem, productivity. Each courses had about 3 levels, and in each level there are 10 sessions. Each session is about 10 minutes. This instruction hope to help make it easier for participants to navigate the application. Emails with weekly logs template will be sent every 2 weeks. This can also serve as a reminder. Demographic questionnaire using a qualitative survey to collect participant data on age, gender, race, marital status, title, years of working experience, and inclusion and exclusion criteria questions. The pre and post burnout presentation survey collects data on participant understanding of burnout and mindfulness application and their satisfaction with the presentations. This questionnaire also evaluates the participant willingness to adopt the Headspace applications. The Headspace Experience Survey collects data on participant satisfaction with the Headspace application after using it for 6 weeks. The weekly log collects applications utilization data. This log will show how many times and how many minutes participants used the application in 1 week. The mass large burnout inventory of healthcare professionals include 22 items assessment that tailor for professionals in human services occupations such as nurses, physicians, health aides, therapists, and social workers. 3 burnout elements that are measured include emotional exhaustion, depersonalization, and personal accomplishment. The answer from each question offer a range of frequency rating choices from never, a few times a year or less, once a month or less, a few times a month, once a week, a few times a week, or every day. To assess burnout level, these two will be administered before participants begin using the Headspace application and after 6 weeks of utilizing it. These two is my guardian in trademarks and will be purchased by a DNP student investigator. The group report costs about $200. The second tool is Perceived Stress Scale, which is a widely recognized tool for measuring an individual perception of stress and ability to cope with life circumstances. This scale consists of questions about emotion, thought, and stress-related symptoms over the past months. The PSS-10 version includes 4 positive and 6 negative items on a 5-point Likert scale. The two scores range from 0 to 40, with higher score indicate higher stress level. These tools also will be administered before participants using the Headspace and after 6 weeks of using it. This scale is free for non-profit educational or research purpose. The descriptive statistic is used to describe demographic information and describe participant experience before and after the burnout presentation and the experience after using the Headspace application. PPT tests will be used to compare levels of Maslach burnout inventory and perceived stress scale pre and post interventions. The parity test will help understand whether there are any differences in the level of stress and burnout before and after interventions. Limitation. Convenient sampling may introduce selection bias, and also self-selection may impact the external validity of these findings. Also, the sample is non-randomization, which may limit the generalizability of the large population. Using pre- and post-tests also may limit the study impact, and also this project is a short duration, so the study may not capture the complexity of burnout dynamic over time.